and welcome to yet another episode of Guest Room. This is me, Naina, with you. Today we have with us Dr. Aneesha Holaday, who is an Ayurvedic professional, and she is coming from USA. Let's welcome her to the program. Welcome, Doctor.
Thank you for inviting me.
First of all, we would like to know more about you.
Well, I was born in England, actually in South Wales, many years ago. And I was educated there, and I got married when I was very young, about 20 years old. And I went into radiation therapy, was my profession, but I was in oncology. I got married and I had 3 children, so I didn't work when I was very young, stayed at home with the children. And then we emigrated to Puerto Rico in the 70s.
Okay.
And my husband had a job there. We were, at that time, a lot of people were leaving England and going to work, particularly in American companies. It was called the brain drain. Okay. He was an engineer, so we went to Puerto Rico with only the intention of spending maybe a year or 2 there. But the inflation in England changed the situation so that we couldn't afford to go back. So we stayed in Puerto Rico. And then we moved to San Antonio in Texas. And in Texas, my husband was working as an engineer, and I went back to work in radiation therapy, which I was trained in. So I had a very high-powered job there as that was the chief tech of the Cancer Therapy and Research Institute in San Antonio. Anyway, to cut a long story short, my husband died there. He was very young. He died of cancer. And I married a physician that I was working with, and we moved up to Washington State. He was an oncologist, and we started up a radiation therapy center, a cancer treatment center. And we ran that for about 15 years, and then he retired. And unfortunately, he has died now also. So when he died, I started to travel. And I've done a lot of world travel. I've been around the world on a ship. I've been to China. I've been Australia, New Zealand. And when I was in New Zealand, I decided that I was going to change careers. And I started looking at natural medicine. And somebody said to me, well, why don't you look into Ayurveda? And I said, well, what's that? And she said, well, I think they make soap. So I did look into it, and I found a company here in India called Jiva. Dr. Pratap Johan, who was set up one of the first Ayurvedic type clinics where he did teaching for overseas people. So I came to India, and with the intention of taking this short course, stayed about 3 months. And in that time I learned yoga, and then went back to the States and set up like a volunteer yoga class in my community, because there was no yoga there. And then I continued my education in Ayurveda with a Dr. Vasant Lad, who's in the United States. He's an Indian, and he's also here in the US and India. And I also took some further education, and then I came back to India, and I've continued my training. So this has gone on over the last 8 years or so. So I've been in Ayurveda now for 8 years, and continuing to learn. You never really learn everything about Ayurveda because it is such a vast knowledge.
What has that made you get into Ayurveda?
Well, I was, like I explained to you, I was in allopathic medicine in cancer treatment. And why I went into that was because I wanted to contribute, as most people do who go into the medical field. They want to do something for humanity. They want to help the sick or something like that. I was very good at physics and mathematics, and so this is like atomic physics. So but I became disillusioned over time, because in medicine now you get less and less removed from the patient, and I was more interested in a caring profession. So, and I didn't really feel that what we were doing in allopathy for the treatment of cancer was really right, because we're not working with nature, we're working against nature. And so that's why Ayurveda was so attractive to me, because it is individualized. Each person may have a disease, and we treat the person, not the disease. That's the difference between allopathy and Ayurveda. And the whatever is wrong with the patient, the disease manifests itself in different ways. So you cannot do a one-size-fits-all for a treatment if you're trying to help someone get well. And it's really more a health system rather than a sick system. I think what we have in modern medicine is a sick system. In other words, we're treating illness, we're treating disease, and the treatment is aimed at the disease and not actually at the person who has the disease. I mean, of course, there's an overlap there, and I'm not saying that there's anything, that it doesn't have a lot of value. Don't get me wrong, it does. But it needs to have the principles of Ayurveda integrated into modern medicine. And allopathy needs to be integrated into Ayurveda. I believe that's where our future is.
Okay. You told that you have been into Ayurveda for the past 8 years. So could you just tell your experience?
My experience in Ayurveda, when I went back to the States, of course, there was nobody who practiced Ayurveda. And I'd always worked in a situation where I was working as a team to do, my work in taking care of patients. And so that was very difficult. And then I'm also working with a system that nobody has heard of. Nobody knows anything about it. So it's extremely difficult to introduce Ayurveda into the West because it's based on an Eastern philosophy, and there's a lot of Sanskrit words in it that don't have any English equivalent word. So it all kind of looks a little bit weird in a way to Westerners at first. But it is, the word Ayurveda. Aru means life, and Veda means knowledge. So it's the knowledge of life. And it doesn't call itself an Indian system. It's not like Chinese medicine or Unani that are specific to a country. The Vedas wrote this knowledge for the earth, for everybody. It is a knowledge that can be transposed anywhere in the world. So after a number of years of coming back and forth to India and doing what I can in the States, and treating people, I haven't got a clinic or anything. It's more of a word of mouth, and people come to me and I do a consultation, I make some recommendations. I have come to the conclusion that the biggest hurdle that we have to overcome in Ayurveda is to get the word out as to what it really is about. It's a holistic system which includes the body, the mind, and the spiritual self. And those three things are not only connected, but interconnected. So to treat one is to treat and to consider the other. So that has been my passion for the past 2 years. I came over to India a couple of years ago, and I met a man who had written the software for an internet television channel. And so we said, why don't we have an Ayurveda television channel? And so I started to make programs and do teaching online of the Ayurveda principles. And anyway, to cut a long story short, I was unable to really do much with that because I was on my own, and it's very expensive to try to do videos and things like that in the West. So I put it on the back burner, but now I am going to be doing that again. I have been invited to do a talk radio show on World Talk, which is broadcast all over the world. And I'm focusing on educating the general public on the principles of Ayurveda and how it influences everyday life. Because it is really a way of living as much as anything. There's so much about our food and our lifestyle, and I think that humanity in the modern society, there's so much stress. We're on a path that's is going nowhere. We have to find our roots again, and I think that Ayurveda will help everybody to do that.
So how's Ayurveda in the West?
In the West, as I say, in America, they're very much into the traditional Ayurveda, which is a little different here in India. India is more interested in bringing it, I think, into today's world, making it more modern. In America, they really stick to the traditional ways of Ayurveda. They insist that you learn Sanskrit, which I have to admit, I know a lot of Sanskrit words, but I haven't spent a lot of time trying to learn that. It's taken me all my time to get my head around Ayurveda, so I haven't really been able to do the language part of it. But that was the way it was in modern medicine at one time. You had to learn Latin. But at the same time, it was different because I have to change the thinking of my clients in order for them to participate in their recovery or in their health. So the education part of Ayurveda is essential. It's not a question of coming and me doing an examination and giving you some herbs and expecting you to go home and get well. You have to understand and you have to participate and you have to change, or not change and do everything I say. That's not what I mean. But so often with Ayurveda, especially how it's happened in India, is that Westerners will come over here and they will do panchakarma because they've heard, and they do this cleansing and everything, and then they go back to the West and they go right back to into the life that they were in before, and so a year later they need to come back to India to do panchakarma again.
So what are the treatments that you do in Ayurveda?
Well, I do yoga. I do yoga, like a yoga therapy.
You're teaching, right?
I teach yoga, but I don't teach Iyengar yoga. I mean, I do more of the pranayama and more, for my age group. So it's not, because I was in my 60s before I started to do yoga. So you can just do so much when you start at a late age. So I teach yoga, I teach pranayama, I do a very involved consultation to find out what people's habits are, what their daily routine is, what foods they eat, when they eat, how do they sleep, what are their sleeping habits? Do they have any stress? Where are the areas that I can advise them that they need to adjust to.
Yeah. Okay.
So that's mainly what I do. And then there are herbs that I can give, but we're quite limited in the West into what we can do. So I go by, just simple things to improve digestion, to help sleep, to if people have blood pressure or something like that, I can give them something to help them do that. But all of those things can be solved through diet and lifestyle. It's surprising how much in today's world of the common diseases like diabetes, like blood pressure, high cholesterol, psoriasis, fibromyalgia, all of these diseases which are related to modern day stress. And it doesn't take very long to get to the bottom of that, I'll tell you. Yeah. And another thing that I'm not going against modern medicine, but it's quite common in America now for anybody who's my age would be taking 5 medications. They'll be taking something for blood pressure, something for cholesterol, something for depression. They might have heart issue, angina or something like that. And they are slaves to the medical system. They have to go to the doctor every 4 weeks or something. They go to many different doctors. But there is nobody managing their daily lifestyle to improve or helping them to improve their health. Because all of these things don't improve health, they just avoid sickness or help sickness. And I think it's the wrong approach. I think we have to go the Ayurvedic approach if we really want to be healthy.
What is your area of interest?
I have been around a long time. I've had 3 children. I've had 2 husbands, both of which have died. I've lived in many different countries. And I go back a long time, and I've seen enormous changes in my lifetime. But I think the biggest change that I see in the role of women and the role of family. I see, especially when I come to India, and where the family is so important, and life still revolves around the family. And I see with the emancipation of women that has happened in the West and is starting to happen here, is that the family is disappearing, the core of family. And I know that that's not always easy. I mean, we've all had difficulties with our family.
Yes.
And you all wish it would go away. But nevertheless, it does give its security for the children, and it's security for the babies, and it's security for women. When women are pregnant and they are having babies, they need protection. And as human beings, we've always had men to protect us.
Yes.
And now, with the emancipation of women, with women being so independent, a lot of my male clients come to me, and they're quite lost in many ways, because the role of provider is disappearing, because women feel that they can do it on their own. But really, in actual fact, the person who suffers for that is the child, and so that's the future of the generation. So that's one of the things that I am over here in India at the moment. I'm talking about how the medicalization of whole human reproduction in everything, contraception, fertility treatments, all of that has taken away our human right, which is to have control over that. And it's because it's part of a family. It doesn't belong in a medical system.
Okay.
And another thing that I think has happened too is that as women have become more emancipated over the years, instead of bringing in that feminine energy into corporations or into government or into whatever, They come in as men. And you take a woman who becomes successful in politics, say, for instance. She's really more like a man with a skirt. She doesn't bring in the feminine, which is important in society, to have that feminine energy. It doesn't mean to say that women have to be at home all day and not be respected, or only be there to do the cooking and the cleaning and what have you. But we need to bring back some respect for that role as women, and I don't think it's gone away, but women are not particularly proud of the fact that they are the holders of the future, because they are the ones that can have the babies.
Yes.
And that's important for our future, because all of that mental stress that babies have by being taken away from, being taken care of in daycare and not have any family around, no sense of belonging, all of that eventually it goes into the collective. Then you have the whole country who feels like that. So the feminine energy is essential for society.
Yeah, okay.
And that is where I have learned that from Ayurveda. And from you people in India.
Okay. So that was nice talking to you. Thanks a lot for being a part of our program.
Thank you.
So that was Dr. Aneesha Holaday with us. Until we meet next time, this is me, Nana, signing off. Take care.